perspectives out there. So we thought, why not bring in an expert, have this conversation, and, have a go at it. I don't think we've had a conversation about updating recovery language on Sober Nation. So it's a great time to do so. Language does matter. And I think that's why we need to start discussing, this in a, bigger platform. I know the conversations have been going around and they've been taking place at conferences. But again, I don't know, you know better than me, Robert, how far these conversations have gone. So why don't you tell our viewers a little bit about yourself, why you're an expert in this topic and why this is important?
Sure. Yeah. And again, thanks for having us on. I remember when we first met, I think Tim, you, and through Devin, we've been involved in Sober Nation for a really long time. And I think you have one of the best communities that exist out there in the digital space for people that are in recovery. So it's a real pleasure to be on. And I think it's important, we use the word expert, right? Especially when we talk about the recovery community, because there's two different types of experts. In my academic life, it means what credentials and letters do you have behind your name? And I'm proud of those, right? But as a recovery scientist, which is a term most people probably haven't heard, it's those of us that are scientists doing research, asking the empirical questions, dealing with substance use disorder and recovery, but we also bring our lived experience into it. So I think it's important, and I saw some of the comments as we were promoting it in the poll. My expertise, I am working on a PhD and have published probably 35 papers in peer-reviewed academic articles with our journals at this point. But I also have 6 years in long-term recovery, which for me really allows me to ask some of these questions, not just from what the research or the studies say, but leveraging what's happened in my own life. And I think that's important. I'm not just flying in from the ivory tower saying, we should study this topic. Like, this is my life.
Yeah, absolutely. And you lived it. And you're not just one of the people. I remember when the recovery movement was just getting started and really mobilizing and young people in recovery, which was an organization that was going out and empowering, groups in different states and cities, mobilizing them to educate people about recovery language. There was a lot getting done and people were having these conversations and even calling out, institutions or treatment centers that were using language that was stigmatizing and saying, hey guys, you shouldn't, we released these guidelines, you should probably start using these. So, this is work that has been going on for a long time. And you guys have been working really hard at not only providing the resources to educate, but also doing the actual education. So I love that you threw that in. A little bit of history, but let's take a moment to welcome our viewers and people who are checking in. I know Devin already said hello. He was one of the first to tune in. Hi, Dee. We wish you were here with us, but maybe we'll do that another time. We'll come up with another topic. Let's see. Jason is saying hello from Prince Albert. I can't even pronounce that. Jason, where is that? We get viewers from
Saskatchewan. That's Canada.
Is it really? Okay.
Yeah.
So who else? Augustine. Hey girl, how are you? Geraldine is back. Yeah. So people are tuning in, checking in, saying hello, and people do understand the topic and what we're going to be talking about. And someone, Augustine, said that she had not heard the term recovery scientist. And that's true. People have not heard, this position, this role of a recovery scientist, right? And what a fascinating time it is that now, recovery is a disease, but it has evolved into, now having these branches and these positions where, and it was all born out of a need, because the only data that we were getting was data from big pharma but there was no recovery research being done. That's what is that correct? And that's sort of kind of what started it.
So kind of, I think it's, there's nuance in everything, right? And I think there's been some really big giants that didn't necessarily call themselves recovery scientists or recovery researchers. People like Bill White, who's actually in Florida, and many of you have probably read his work. He's kind of the seminal researcher in the space. John Kelly, Tom McClellan. Yeah, I mean, John leads the Recovery Research Institute up at Harvard and Mass General. And I think, for a term people probably have heard, just for those that are, I saw the comment in the chat, recovery scientists never heard it. I think everybody's probably heard the term addiction scientist, right? So the study of treatment, the study of prevention. all the brain disease research that we get into, chronic relapsing condition that's centered in the brain from places like the National Institute of Drug Abuse. But the difference is, if we look at addiction science for a really long time, recovery was just one of their most common outcomes, right? They have a study, they're studying treatment and relapse and all this, they're looking at percent days abstinent, and that was their essentially their consideration of recovery. But it wasn't a process, it wasn't a lifestyle, it wasn't an identity. It was just this kind of dichotomous outcome variable. And for us, which as we started calling ourselves recovery scientists, there's a group of about 40 of us at the Recovery Science Research Collaborative, started out of Kennesaw State. 90% of us are in recovery, so we have this lived experience that I talked about before. But we just kind of assume, let's take as a given that addiction is a disease or a substance use disorder, that it exists, that it can be treated, prevention is important. But really, we want to study recovery not as an outcome, but as this really robust process. So things like, how does recovery manifest over time? What are the different pathways that people do recover in, whether it's 12-step mutual aid, whether it's smart recovery or she recovers, or medication, or just naturally remitting and recovering? We want to talk to people and learn about their stories and identity transformation, but we want to describe this really dynamic process, which is recovery, because it's more than just an outcome from treatment. It's this life-changing event. So I think the really cool part is that we switched the script of what we're focused on. Rather than recovery being an outcome, it's this process, this phenomenon that's amazing. And I think the other part of recovery science as a field is that we engage in this community-based participatory research, which is a really fancy way of saying we don't do any research without engaging with the recovery community and the stakeholders it impacts. So every study we've published, not only are the scientists, many of them in recovery themselves from behavioral health disorders, but we actually engage with peer specialists and peers and people in the community, the recovery community, to help design the studies, to help analyze the data, and then help write up the results that we're publishing. And I think that's it's not only so cool, right? Like, what a time to be alive, but it is very different than addiction science.
Yeah, I love that. I love that it's so organic, and so that it connects all the moving parts and all the pieces and makes it somehow pure, pure data to some degree. And I think that's just amazing, the work that you guys are doing. How can people get involved real quick? I know towards the end, we're going to talk about how people can connect with you, but if somebody wanted to be involved like in these tests or these research events, where would they go?
Yeah, so the two easiest ways, so if everybody's at a computer, right? If they're watching this or on their smartphone, you can go to Google and just search the Recovery Science Research Collaborative, and the first hit will be the landing page at Kennesaw State University Center for Young Adult Addiction and Recovery. And then you can read more about it, recovery-informed theory and our approach to research. And actually on Facebook, there's a private group that you have to search for that's actually called the Recovery Science Research. I can't remember the last name. I think it's group, but essentially we started it a few months ago, and people can opt into that group. And the only thing that gets published in there is when recovery researchers or addiction researchers are doing recovery-centric studies. They'll actually post the links to the informed consent, and people can participate because, as you know, right, and for a variety of reasons, it can be hard to find people specifically in recovery in large enough samples to do this research. So it's one way we're trying to give back by leveraging social networks and others. So if you do a search up in the top on Facebook, you can find that group, apply to join. And if you want to participate in research, definitely it's a way to give back to the community, right? The more that we know about ourselves, the more we can teach the world about how to support recovery.
Yeah, and what's working and what's not. Exactly. I love it. In the meantime, let's just say hi to a couple more people. Alexis says, listening and loving your work, ideas from Utah, positive verbiage matters and it makes a difference. Brittany's saying hi. Chris is saying hey. Joseph is watching from Jersey. Laura is checking in from Missouri. Sue says it's her first time listening. Thank you so much for tuning in. Jason from Canada, and Chris from Baltimore. So let's dive right into this because we have a lot to cover. And this is a topic that, again, a lot of people in the community were interested in. Please explain what updated language is. Like, what is even this concept? Like, why are we even looking at these words and needing to do something about them?
Yeah, and I think we have, as you mentioned before, we've done a lot of work within the space. And when I say we, I mean the larger kind of advocacy community. So, this trend to change the way that we talk about addiction or severe substance use disorders and recovery really can date back to the early 2000s. Many of you may have taken the training that Faces and Voices of Recovery put out that was called the Media Messaging Training. Our Stories, Our Words Have Power, which was focused on how do we change the public perception, not necessarily how we change the way we talk about ourselves or in meetings. It wasn't necessarily about that. It's, to the general public, to policymakers, to media professionals and journalists. How do we use the language that's going to get them to tell the story of recovery and hope, rather than focusing on war stories, as many people know them, or active use stories. Those things they're critical for our own internal recovery process and catharsis and identity reformation, but it doesn't necessarily make people want to support really good public policy that helps the newcomer, helps people just like us. So it was really driven by the advocacy community, a bunch of people in recovery that were becoming faces and voices of the community to try to change drug policy and recovery policy in this country, that said, what, this isn't working, let's try something different. And then it's kind of continued over the last 2 decades, right? Young people in recovery created the recovery messaging training that's, took the favor training and said, what if, this makes a lot of sense. We feel good when we talk about ourselves in this positive, non-stigmatizing way, when we say we're people in recovery rather than addicts or alcoholics or junkies or any of these things. Why don't we talk like that all the time? Why don't we talk to our friends and our family members, the rest of the general public, not with an agenda to change policy, even though that would be nice, but so that we can begin to change the entire story of what substance use disorder and recovery looks like in all parts of the country. And then, so all of that was kind of based on anecdotal lived experience, the stories of people, of how the language worked and made them feel and made others feel. And then we started seeing research come out, the empirical backing for what people were saying about the language they were using. So the first study came out from John Kelly and Westeroff, who went to clinicians and said, if I give you this vignette and this person's described as a substance abuser versus a person with a substance use disorder, do you blame that person? Would you recommend treatment or a punitive treatment plan, like going to jail versus going to a residential or inpatient treatment program? And this was to licensed clinicians. And what they found was that the vignettes with substance abuser to these licensed professionals, not even the general public, they would more often recommend punitive approaches and blame that person for their substance use disorder. And it really, the thought there was, man, imagine if the general public got these, what they would think, if even these licensed professionals that are trained, many of them probably had lived experience, imagine what all these people with no information about addiction probably responded to. And then we saw a range of studies come after that, right? It was enough ammunition and kind of galvanized the recovery community and other researchers. And we saw studies come out from Johns Hopkins and the Stigma Lab, some from the University of Iowa, that began testing things like treated and untreated, depression, schizophrenia. And then we get to our range of studies, and I'll wrap up here since we'll talk about more of it. But we had gotten a whole lot of information from those trainings when we asked people, what are some of the stigmatizing labels you've been called that you think might be harmful? Substance abuser, addict, alcoholic, relapse, medication-assisted treatment, words like junkie, crackhead, all of these different things. So we actually set out to test those empirically. So we went to people in recovery, healthcare professionals, and the general public, and tested these in an experimental design to see what type of bias or stigma was elicited when we used negative words versus words like person with a substance use disorder, person in recovery, pharmacotherapy, recurrence of use, alcohol use disorder, et cetera. And we essentially found exactly what people in recovery were saying since 2001, that words matter. And we'll get to a little bit later what that means for the individual in recovery and in meetings and in private settings, because this isn't a blanket statement saying you should never use it, right?
Right.
It's that we need to understand that the words we use influences people's opinions, which influence things like help-seeking behavior, is somebody likely to go to treatment or not. It influences things like funding, which is critical to expand our systems and to help the people that are out there still using drugs and that have a substance use disorder. Like, it impacts everything, whether we like it or not.
Yeah. But can we just take it back to that statement? Because I think that is so powerful. So a licensed clinician would choose to be more punitive towards an individual labeled a substance abuser than somebody. Can you repeat that entire little piece? Because that is pretty.
Yeah. So there's this idea of vignettes, right? Which is really just a way to say a short paragraph with some information. So John and his research team went to this addiction conference, and there was 500 clinicians there. They split them up into 2 groups. One group got this short paragraph about a person that was a substance abuser that essentially needed treatment, and what would the clinician recommend as a treatment plan, and were they likely to blame that person, that they were at fault for that issue, which in this case was substance abuse, or were they likely to recommend treatment and non-punitive measures focused on rehabilitation, and were they not likely to blame that person? And the other vignette was the exact opposite. Everything was the same except the term substance abuser was pulled out, and that person was labeled as having a substance use disorder. And the difference was in the outcomes is that where substance abuser was used, or the stigmatizing term at that point, more punitive measures and more blaming of the individual were found, versus in the non-stigmatizing condition with substance use disorder, where treatment was recommended more often, the person wasn't blamed. So vignettes are just paragraphs where you give information to somebody, change something, and then you ask what they think about that.
That is mind-blowing to think that, licensed clinicians, and it's just because words mean things, right? And like words matter, and they do influence how we perceive certain things, right? So that's just such a great example of like how those stigmatizing terms can actually change the course of someone's life, and can affect the quality of care that you receive, can affect just so many things. And I'm so happy we're having an opportunity to have that conversation now. So can you give me some of the examples of some of the words we should be replacing?
Yeah, and I'm actually, for those that aren't on it, I'm putting an infographic in the chat box so you can kind of follow along. So all the research that's been done to date, right, they've all kind of focused on some specific words and words that are used kind of most often, either by professionals or the general public or those in recovery. So we'll go through the stigmatizing. I'll say the stigmatizing word first, and then what the research would say is the non-stigmatizing version or replacement term for that. So the first one that was tested first, we've already talked about, is substance abuser. Its non-stigmatizing replacement would be person with a substance use disorder or substance misuse.
Okay.
Next one would be what the title of this talk is, right? So addict and alcoholic. Those were tested in our study, and I'll post the link to the paper for those that are interested in reading it. We tested as both of those terms were either then replaced with either person with substance use disorder or a person with an alcohol use disorder. And then we have words like relapse, right? Which isn't inherently negative or stigmatizing in itself, though. I got after treatment, I spent 2 years in a 12-step program and still practice a lot of the actual principles, and it's a common term that's used within that setting, right? The relapse. And what we were finding when we talked to people in recovery is that it implied failure. It didn't necessarily invoke high self-esteem and self-efficacy, so it was worth testing. And what we found was that all those connotations and bias did exist. That recurrence of use or recurrence of symptoms was a much more positive replacement term that meant the same exact thing. And that's the important thing here. All these replacement terms mean the exact same thing. So I think a lot of people say, well, if I forget, especially those in 12-step recovery, right, is that if I forget that I'm an addict, an alcoholic, or a substance abuser, or a junkie, like I may fall back, right? Like we always have to remember. And the suggestion is to forget that. It's just to use a different term that means the exact same thing. Like I'm still a person with a substance use disorder. I'm never going to forget that. I just choose not to call myself an addict and alcoholic anymore because I know the damage it can do, especially in the general public and for people that haven't found recovery yet. So some other terms were medication-assisted treatment, which again, not inherently stigmatizing in itself, but within the recovery community and the general public, it has a lot of bias associated with it. So we found that substance use disorder or opioid use disorder pharmacotherapy, again, means the same exact thing as MAT, was a more positive and non-stigmatizing term. And then I think the cool one, just because it really highlights the kind of the resilience and positivity of recovery, is that long-term recovery and medication-assisted recovery both tested the most positive out of any word pair that we tested in the study. And the full link I'm posting right now, but those are the big ones that we've tested so far.
Yeah, no, and that makes sense to me for sure. And I'm glad that you shared the infographic in the comments so people can follow along. But in the poll, we did a poll last week, earlier in the week, where we talked about, the term addict and alcoholic, and our community had a lot to say about this. And like you mentioned, some people said they were, they needed to be reminded that they were addicts and alcoholics. They needed that to be part of their, their not identity, but part of their day, so to speak, so that they can continue to recover however they're recovering. So Danielle she says, I'm a grateful recovering addict and alcoholic. That's all I care about. Valerie says, I don't care what I'm called as long as I'm sober. Shannon says, I am an addict in recovery, and I say this because I will always be an addict. I just won't go away, so that's why I say that. Ellen says, I'm an alcoholic. The moment I pretend that I'm not is the moment my relapse begins. So there's a lot of that there. And totally valid. I think everybody has, their own experience. And again, this isn't to say, any of that isn't valid. It's just having a conversation about expanding the conversation of recovery language, right? And like the fact that these words do affect sometimes in different settings. If you're having a conversation, peer conversation, or mutual aid groups like 12-step groups is one thing, but when we're taking these words and using them in the press, in clinical settings, in places where policies are being made, that's where the harm could get done, right?
Yeah, and I think it's that point really needs to hit home, and it's you said a lot of good stuff there, all of which is correct, and I think it's important for people watching, either on the replay or live, is that the suggestion is not to take away people's autonomy, right? People should have the right to self-label any way they want. You want to call yourself an addict or an alcoholic, you want to call yourself a dolphin or a mermaid or a unicorn, like whatever. I do agree with a lot of the comments that I would prefer just to be called Robert or a human, because that's really what we are, right? Like we shouldn't be our labels. We're not necessarily our disease. But that aside, is people should retain that right, especially in private settings. All we're suggesting, and what the research is suggesting, we can talk about a pilot study that gets a little deeper into this, but this concept of recovery dialects is label yourself however you want. Where you need to pause is a couple of places. One, if you're a person in recovery, think about just using those in mutual aid meetings or in private settings, because there's harm being done when we use those in public settings. So if you're talking to the newcomer or the individual just getting out of treatment or in treatment or any other private setting or one-on-one service work, use whatever language you're comfortable with. And I think there's a lot of value. There's some other research around catharsis and spoiled identity that makes sense. Like there's probably not a ton of harm, or at least we don't know yet if there's any harm coming from that. But when you choose to be in public settings, whether you're telling your story, whether you're talking to employers or policymakers, et cetera, healthcare practitioners, journalists, like that language is doing harm to our community. And I think that's what we're trying to say is think about, use whatever labels you want, but do it with this additional information. I mean, science doesn't particularly care what your opinion is. And that's, if that comes off wrong, but it's not like this empirical backing. Like we know this stuff to be true. It impacts the quality of care that healthcare professionals give to people like us. People use drugs, people with disorders, people in recovery. People don't seek out treatment because they feel stigmatized. 40% of people that don't seek treatment every year that perceive a need for it do not go because they are stigmatized or they feel that they would be stigmatized.
Right. They feel like their doctor would judge them, that, they feel like if they share with a nurse, like the medication list that they're on, maybe they're on medication assisted treatment and, they go into a hospital for something else and they feel embarrassed to like share that they're on medications for stuff that they would recognize as to recover from drug use.
Exactly. So a really good example of that, and we were talking on Twitter because somebody had shared an electronic health record where this client's urinalysis results, every single one for the last 6 months was either clean or dirty, right? Like this, are we talking about whether this person showered or their personal hygiene? Like that's the type of stigma that we're trying to push back against. That language is not okay. It's, you have a positive or negative urinalysis. So it's just a consequence of this kind of deeply rooted moralistic language, especially in healthcare settings and in other public settings. That's all part of the same vein. We're just trying to give people reduced stigma so that everybody has the chance to recover like the rest of us had in the best and quickest way possible, whether that's changing policy or feeling non-stigmatized. Like changing language is easy, and it doesn't even have to happen in the rooms of any of the A's or any other mutual aid setting, but it should happen in public.
And to be fair to, the movement and the recovery community, we've been out on our own for a few decades now. We've never had any support and anybody like really doing research on our behalf to see what was the best care, what we could benefit from after leaving a treatment facility, what a continuum of care was after we were discharged from a treatment facility, what would happen to us after. I mean, this is really like the first time. So people had to come up with terms, with words, with whatever they had at their disposal to describe what was happening. And so now that we're growing as a movement, being recognized as a disease, we need to start making those changes in those words so that when we talk about this disease, it gets treated like a disease when it's being talked about, if that makes sense.
Yeah,
Okay.
and I think that's important. If language didn't change, if we were still stuck and wanted to do everything the status quo rather than being informed by our best evidence to date, right? And in the big book, even the basic texts were all written based on doctors' opinions and a bunch of lived experience, which is all this really is we would still be calling all of ourselves inebriates or drunkards or winos. Like, we don't use that language anymore. I mean, there's many constants in life, right? You're going to pay taxes, you're going to die. But the other is that language is constantly changing. And I think, again, if this is about helping everyone else to have the same opportunity as us, we should put our best foot forward.
Yeah. Well, why not? Let's see what other people did say. They did agree that it did carry a lot of stigma. Greg said we need to get rid of the term alcoholic. An alcoholic is an addict and their choice of drug happens to be alcohol. There's enough stigma and division in mental health. As to the actual question, I think it is important not to identify as your illness. Substance use disorder is not the sum of who we are. It is a part of us. I just love how he said that. And I think that was such a great statement.
Yeah, and I think, identity is this nuanced thing, right? And I think for a lot of people, the recovery, their substance use disorder, their mental health disorder, it really is a big part of their identity. And I think that's an individual choice, right? But I agree that it's, really what we're talking about, this person first language movement is about bringing the humanity back. I mentioned it earlier. And I think it's a really important part that he said is we're much more than just our disease. We're much more than even our recovery, right? Like, I'm a new father. My daughter, Penelope, is 5 weeks old and hopefully sleeping upstairs, but like, I'm proud to be a dad. I'm really proud to be a dad in recovery because my daughter will never have to see me pick up a drink or hopefully be, symptomatic in my mental health concern. Like, that's proud, but I really am just proud to be a dad. Like, I'm really proud to be a student. I'm really proud to be a homeowner. Like, all of these things, I'm Christian. Like, I have so many different intersecting parts of my identity. I probably latch on to my recovery identity a lot, but that's my choice. But to think we're just one thing, to distill it down, but I think that's what some of that stigmatizing language does. Like, if you were to go out in the street, right, and just talk to 100 people that you just walked by and said, what do you think about addicts? They're not going to think about, well, that's people's sons, daughters, brothers, aunts, uncles, nephews, husbands, wives, partners, employees. Like, it really does dehumanize. I mean, that's what stigmatizing and stereotypes do. And I think that's really a big part of the picture. Everybody watching, if you can think how many different things make up my identity, how would you feel if your identity is distilled down to one thing by anybody that hears a label that all they can think of is the worst thing they've ever been told by the media and everything else. I think that's part of the picture too.
And that is a perfect segue to the next, set of comments that I wanted to read is the fact that a lot of people don't want to be labeled anything. And again, that's turning back to the humanity, right? And so, Jen says she prefers to be called by her name. Her recovery status does not define who she is. Laura says she doesn't like labels at all. No disease should define a person. I prefer to be called a happy person, is what she said. Patricia said, I prefer sober if someone feels the need to label me, which is rude. I don't call somebody diabetes or cancer, which I thought was also a very good point. And Casey said, it doesn't matter to me as long as I'm not referred to as a junkie. So, people just are over labels. They don't want to be labeled. And so I think we're all trying to somehow say the same thing, but my thing is, how can we all get on the same page? Because there's so many different viewpoints, and so many different, perspectives on this. Like, how can we all get on the same page?
I mean, I think there was another comment, I can't remember if it was on Twitter or here when I posted it. And there is a lot of really big issues that are affecting the country, right? Especially concerning with substance use and recovery. We have, polysubstance use crisis, an overdose crisis. We have all of these things. We have a lack of funding. We've got so much going on that we need to talk about. I think language is one of those. But we do all need to get on the same page. And I think the infighting around language is probably doing some more harm than good, right? Like, there's probably a lot of divisive comments whenever we talk about language because people are so strongly attached to the language that helped them find recovery. And a lot of those come from mutual aid settings. And I think respect is what it comes down to, right? Like, whether you like to be called your name, whether you like to be called a human, whether you like to be called happy, like one of the commenters had said, like, what we should do is ask people what they want to be called and not assume. And I think the same applies for people. Like if you want to label yourself something, go right ahead. Again, do it in the context that knowing when you do it in public settings, you might be harming others, and you should think about that. But at the end of the day, we've got to respect where people are at. I think, our goal as researchers and my goal as an activist is not to shame people into changing their language, because I think personal freedom is a huge thing that matters.
Yeah.
But I think it's sharing information. Like how many people didn't know that the language we use impacts the number of people that actually seek treatment or engage in recovery support services. And if you didn't know that, hopefully it makes you think twice. So I think it does come down to respect. Ask people what they want to be called, respect that. Try not to shame people, gently remind them that if they're using stigmatizing language that we know from research is stigmatizing in public, ask them, hey, did you know this? Maybe you couldn't. And if they still choose to, like, that's their choice. I think we have to default to education rather than just yelling at each other. It doesn't help. And it makes our community that much more stigmatized to the general public when we're fighting amongst each other.
Yeah, no, absolutely. But I think that there's two worst offenders. I think journalists are high on the list. I think that they really do a horrible job at, they report on a story, and we get it. They want to get viewers or readers. And so they have to create this headline that's just, scandalous, and, a junkie dies on the side of the road, or, junkies overdosing. And I think that they're really some of the worst offenders we have out there. Also, some professionals and institutions need to stop using some of these terms. So can we talk about what we're doing with the press, and on board?
Beating our head against a wall is often what it feels like with the press. So we do a lot of work here, right? We've just more recently begun trying to educate the recovery community on some of this research in our work, but a lot of the time has been spent on editors and journalists, beat reporters, law enforcement, institutions and government officials and policymakers. And we've had a lot of progress, right? Like the Associated Press put out its revised guidelines a few years ago that it essentially suggested to all editorial staff and copy that addict and was not used unless it was a direct quote from a person, right? That they weren't supposed to use substance abuse, or it should be substance use disorder or addiction. So that was a really positive step forward, but it hasn't, not every outlet is using those, right? We still see headlines every day with stigmatizing language because it is attention grabbing, and they want clicks and they want views because it's a business, right? The New York Times is awful for this. They every time we talk to them, they're like, people don't know what these word means, which we know is not true. Like people absolutely know what a substance use disorder is. It's just more words. They don't want to print it because it doesn't grab really strong headlines and clicks. But they refuse to follow the AP guidelines. So one of the things that we've done most recently with Zach and Professor Beletsky at Northeastern, and a whole lot of other people like Brooke Feldman and many others that I'm going to forget, but it's called Changing the Narrative, and it's at Northeastern University, and it's a resource hub that's launching in a few weeks. That's all the research, some narrative stories, a bunch of experts that is geared towards just journalists and the media to go a step further than the AP guidelines and not just say, here, do this, but it actually provides a ton of empirical backing of why they should make the changes. So the hope is if we plead to their sensibilities, like, hey, you're killing people, especially in the midst of an overdose crisis, the more you stigmatize, the more you draw down public support because you're using this language and making people stereotype and other everyone, like you are truly, in this day and age, killing people and doing a lot of other really nefarious things. But we're hoping that'll make a difference. So it's a tool for them to use real time. So they need replacement terms for a word. Do they need to know what the research says? They can use it as a resource hub. So I think that'll be cool. And some of the other offenders, right? We've been on a mission to change the National Institute of Drug Abuse, the National Institute on Alcoholism and Alcohol Abuse, the Substance Abuse and Mental Health Services Administration, all of these different entities to get their name changed, but it takes an act of Congress, which is a pretty impossible task if you've been paying attention over the last couple of years to get an act of Congress passed. So that hasn't happened yet. But I think one of the really cool things, and if anybody in Maine is watching, the Young People in Recovery chapter up there a year and a half ago got a piece of legislation passed at the State House that actually stroke every stigmatizing term in previously passed legislation going back until the beginning of time in Maine, organized politics, to all legislation moving forward, and all of their individual departments. So their Department of Drug or Substance Abuse or Substance Abuse Services, everything got changed to non-stigmatizing language. And the bill is just, it's a really model piece of legislation of what it looks like to operationalize non-stigmatizing language in politics, and it changed both legislation and social service organization titles, which I think makes a big difference, right? Like every little bit helps.
Yeah, absolutely. So where can people go and connect with you and learn more about you and the work that you're doing?
So social is a great place, right? If you're more interested in recovery science, and we do a range of research on surrender service programs and harm reduction organizations and recovery community organizations, collegiate recovery programs, recovery high schools, theory, and all of medication or pharmacotherapy.
Talk about what you're doing in Philly with
I'm getting there.
Okay, I'm excited about that project.
I want people to like it. We don't just research language and try to tell people how to talk and what to do in health communication. We research everything that has to do with recovery. But Twitter is a really good spot for that. So at RD Ashford, I got a neat little blue check mark recently, which I'm super stoked about. But I tweet all of our research out there. There's a huge recovery science and recovery community on Twitter with hashtag recovery movement. That's a really good spot. And one thing that my wife and I have recently decided to do in Philly is we're actually opening up a recovery and trauma-informed yoga studio and a recovery community center that's always free. No services. People can come in 30-plus recovery meetings a week, 30-plus yoga classes. They'll have access to free individual certified recovery specialists to do one-on-one coaching. It's open 7 days a week, almost 12 hours a day, but just a free recovery community organization in Philly. So we're super excited. Yoga has been a big part of our personal recovery. So the second floor of the spot is the yoga studio. It's kind of traditional recovery yoga, trauma-informed yoga, and then vinyasa classes. If anybody's a yogi, you know what I'm talking about. But then the third floor is the recovery community center. So it's just straight drop-in RCO, which is really cool for us.
Go there, hang out with other peers, or, go see a coach, or just kind of have a place to go in your community.
Yeah, work on, with the coach, they can work on all these recovery support services. So employment, housing, education, access to healthcare. They can work on resume building, job seeking, et cetera, et cetera. We also host 30 different types of recovery meetings. So Alcoholics Anonymous, Narcotics Anonymous, DAA, She Recovers, Smart Recovery, Refuge Recovery, SOS, Celebrate Recovery for those that are more religiously oriented. We also are starting a mutual aid harm reduction group. Another shout out to Maine. A group up there started the Harm Reduction Works mutual aid meeting. MARA, which is Medication Assisted Recovery Anonymous. So literally every different type of pathway, all recovery meetings. We're supporting families with certified family recovery specialists. So it's really just a community resource. And our goal is, how do we bring what was freely given to us and make it free to others, and just make sure the community is celebrating recovery. We're in Philly, as many of you probably know, the overdose prevention site combo has been going on a lot. It's a really important combo. But at the same time, my wife and I and our group of friends just wanted to really celebrate and lift up the recovery community. And we need centers like this and yoga studios, I would say too, in every district of every city across the U.S.
Everywhere where you can access services for free and just have somewhere to go and somebody to listen to you. And, I'm so stoked that you're doing this, and I just wish it was everywhere. And, whatever we can do to support you, let us know. But
two things. I mean, if people want to check that model out, or if they want to see what we're doing, it's Unity, UNITY, recovery.org, and you can read more about it there. Speaking of the language, I'm going to post the link that's in there. We've been doing this person first pledge, which is nothing more than committing in public settings to use positive language to help lift up our community and destigmatize substance use disorders and recovery and people who use drugs. It's linked to take. We've had about 1,400 people take it in the last month and a half, partnering with a lot of different organizations. So for those that are on the chat or watching the replay, would love for y'all to go and check it out and take the pledge.
Yeah, for sure. And again, this is not a treatment center. This is completely free. This is a recovery community. And it's just amazing. I'm really excited because, again, in the recovery movement, there's been a lot of talk about doing these and we know how much we need them. Everybody wants to do it. So to watch somebody actually make it happen and this come to reality, I'm so excited about it. So, Robert.
If somebody thought it was treatment, just to hit that point, I'm like, this is not treatment. These are non-clinical, peer-based services, people helping people. I think that point needs to be made. Look up recovery community centers and organizations. They're a really cool thing. There's about 100 across the country.
Yeah, exactly. No, I wanted to make that point again because that's a really important piece. And I can't thank you enough, first, for taking the time to join us tonight. Again, you're a new dad. You have so much going on with school, Unity, like you just have a lot going on. So thank you for taking the time to join us tonight to talk about this topic. We appreciate it so much. And again, if you want to connect with Robert, he mentioned and he even shared a couple of links. So definitely reach out to him, stay connected, learn what you can do. If anything, you know, resonated with you, let us know. You could hit us up on email or send us a message if we want to continue this conversation in the future. If there's another topic you want us to discuss, we'd love to do it. So thank you so much for watching, Robert. Thank you for being with us tonight, and we're going to sign off. Good night, everyone.
Thanks, guys.